All of them generally have crisis. And the crisis you are talking about, most of the time, we call it vaso-occlusive crisis, meaning pain. Pain is the usual crisis that sicklers have. In fact, it's what makes them be called sickler. They are always having pains. And their own type of pain, the pain that everybody has is coming from the muscles. But their own pain is coming from the bone. So it's actually any type you have pain, muscular pain. The type of pain that sicklers have is at least 10 times the type of pain you have when your muscle is paining you. At least. So their own is that. So when you see a sickler crying, there is actually an agonizing pain. It's very, very painful. It's as if you are hitting them with sledgehammer. That's the kind of pain they have. We call it vaso-occlusive crisis. They also have other types of crisis, but that is just the commonest type of crisis they have. They have other features. You see their eyes might be yellowish. They have jaundice because their blood cells are constantly being destroyed. Their blood level is always low because their cells, because of the shape of the cell. So when it goes through tiny blood vessels, it easily breaks down. So, and because of that, they have a lot of jaundice that will form as yellowness of their eyes. What other thing? Then you said pregnancy-induced hypertension. That, it now depends on, there's what we call, it depends on what actually causes the pregnancy-induced hypertension. Some are due to placenta factor, while some are due to autoimmune factor. Those that are due to placenta factor is the placenta that is seen is because of the presence of the placenta. The body doesn't like, placenta is a component of the pregnancy. There is placenta and there is baby. Okay? So, but the body is seeing that placenta as a threat. The body doesn't like that placenta. And that is why the blood pressure is high. Because it's just seeing it as a threat. Okay? So, and once, we call it placenta factor. Once that placenta, the baby is delivered and that placenta is delivered, the blood pressure will just visual out. Okay? But for those that after delivery, the blood pressure still remain, they are due to autoimmune factor. Autoimmune because the body is seeing that baby itself as a threat, not only the placenta. So it's seeing the whole component of the pregnancy as a threat. So it has now developed some cells, antibodies, that is now attacking the body system. And that is why the blood pressure refuses to go even after the pregnancy has been delivered. Okay? Some of them, over time, after some period of treatment, especially when the woman does not get pregnant quite on time, the pregnancy might go. But it doesn't go immediately after delivery. So that's autoimmune factor of pregnancy-induced hypertension. But the one that is due to placenta factor, immediately the child is delivered, placenta is out, the hypertension. Have I answered all your questions, ma?
Yes.
Any other question?
Praise the Lord. It's about the cancer. 2 weeks ago, we lost somebody to that disease. My senior brother's wife. And he has 4 children for us. I want to ask, can somebody contact cancer? Because my senior brother was taken care of. You know, it seems in the hospital they reject them. Because she was going to the hospital and later she left when they said there's one babalawo somewhere that comes to give them, it was breast cancer. So after when it got burst, and water and blood was rushing out. So the man came and said, láti gbé lọ sí hospital ni o, because that place was so big. And I think my brother's wife was having sugar something. And then when taking her to the hospital, I don't know, is it chemo, something like chemo?
Chemotherapy, that's the drug.
Okay.
Chemo.
It was being given to her, and then she could not walk again later. Then for so many months, she was at home, and my senior brother was taking care of, and the children were taking care of her. So 2 weeks ago, she now gave up the ghost. So my question comes, can somebody contact it, or the children, or the husband? That's what I want to know.
Okay, well, when we say a disease is contagious, it means you have the disease and the person staying close to you or having contact with you contacts that disease from you. Just like you are coughing, the person has tuberculosis. Then when you cough, the people around you while you are coughing can contact it. Then somebody has HIV and meets with his or her partner, or by virtue of blood transfusion. So anybody that has contact with that person or that person's body part or body fluid will also have that same condition. That's when we say a disease is contagious or can be contacted. But the answer is no. Cancer is not contagious. But when I was discussing cancer, I said that there is what we call family history. It can be inherited. The gene can be passed from one generation to the next generation. You know, at times you say, you don't need to ask for the mother. Immediately you see this child, you know that is her mother because they look facially alike. Even at times, physically, they look alike. Because that gene that expresses their physical appearance is alike. That is why they look alike. Okay? Then there are times you also pass on that same gene. Because at times some cancer has been there from childhood. The gene has been there even as a child because that child has inherited it from somebody. So, but it's just developing, just waiting for the right time before it will now manifest the symptoms. Okay? So the person has had it as a child, but we only develop in adulthood. So that's the only one. It can be inherited. So for that woman now that has cancer, the husband has no problem at all because his family is different from the woman's family. So their genes are not the same. Okay? But the children of that woman, the sisters of that woman, okay? And even all the other relatives that have family bond with that woman, all of them, the females especially, they need to go regularly for their breast check. Like the children, if you want to help them, let them go regularly for breast check. Because it is possible they inherit the gene for that breast cancer. So that is the only point. It's not that they must do, but there is a possibility since they share that family inheritance, that family bond, then it's a possibility. But not that because the person has been the one taking care of her and has been maybe her hand has touched the breast, that part of the breast that has cancer, or maybe the cloth she wore, she's the one that went to wash the cloth. No, it cannot be contacted through that way. Even she and the husband that have been sleeping on the same bed cannot contact it through her. That's the answer to that question. Any other question, please?
Praise the Lord. My first question is on the issue of pregnancy-induced hypertension and blood sugar. Is it possible to prevent it? Can it be prevented? That's one. Then two is on the issue of beans, pill, whatever. So I want to ask, because I have a mother who has this issue of blood sugar, whatever. And I don't know if that's one of the advice she was given in the hospital, but I know that if she wants to cook beans, of which beans is one of the food that she eats most. And if she's cooking beans, she will parboil it and change the water for like 2 or 3 times. So I'm surprised now to hear that the back is the main one that contains the protein that is needed. So which means parboiling the beans, removing the water, the protein has been washed off. So it is carbohydrates she's eating. So I want to ask so that I will know how to educate her on that. So is it that it is wrong, what she's doing is wrong, or it is normal for her? Then for somebody that does not have the blood sugar, whatever, for like we normal, I know I used to have that issue. When I eat beans, I usually have, sometimes I have this burning sensation. And I know people usually